You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Black Americans are nearly 3 times more likely to die from the virus than their white counterparts, but because of a long history of mistrust, studies suggest that Black Americans are less likely to get vaccinated than other ethnic groups. Joining us right now is Tiffany Tate. She's Executive Director of the Maryland Partnership for Prevention. But also, what Tiffany is doing is she's working on something that could be of great benefit to HBCUs. So, Tiffany, let's talk about that. Again, you just heard me talking about the collective and how that matters. Speak to that when it comes to what you want to do with HBCUs and Black folks when it comes to COVID.
Well, thank you first. First, let me just say thank you for having me on the show. This issue is extremely personal for me today. I lost a cousin to COVID just this morning.
So sorry to hear. Condolences.
Thank you. I've been committed to public health and committed to this fight against COVID since the beginning. And now to have it hit so close to home, I'm really taking all of what I'm saying to heart. What I'd like to do, even before this happened, I wanted to make available our technology to HBCUs because in order to play a significant role in this response, we need institutions in our community to be advocates of the vaccine, to be advocates of promoting health in general. And in order to do that, you need the tools and resources to do that. So we have created technology that's been in use for over 4 years and now is being used by more than 20 states and municipalities in this country to be able to alert people that the vaccine is available, to allow them to select an appointment wherever they'd like to go, wherever it's convenient, to consent to the vaccine by providing their demographic information about health screening questions so that we know whether or not they're eligible for the vaccine, and then consenting to it and going and getting vaccinated and then having that information electronically transferred to systems that are administered by government agencies so that we can collect data on vaccinations and making sure that everybody is protected. This technology does not come cheap, but we want to make it available to the HBCUs because many don't have resources to buy this type of technology to be able to get in the game. And far too often, historical providers in our community have been excluded from participating in these types of important efforts because they don't have the resources. So by making this available for free to HBCUs, that should be a first step or another step in allowing them to have a really critical role in this pandemic response.
When we talk about the technology, so just walk through exactly what is it that you're providing to the HBCUs?
Okay, so there's 2 systems. One is called PrepMod. And so what PrepMod does, it has 2 pieces. The first piece is something that is accessed by the consumer, by the public. So they'll go to a website, they'll type in their address, and they'll search for a location where there are vaccines are being made available. So I go in, I type in my address, I say that I want to go somewhere within 10-mile radius of my home, and the system generates all the locations in that area where someone can seek a COVID vaccination. Once I select that vaccination, it takes me to a consent form. And in order to get a vaccination, you have to consent for the services. So typically that entails going to a location, filling out papers, having clipboards and pens and all of these things, and not knowing and not being able to alert people in advance that you're coming. And that often results in long lines, very long lines. And when in these age of where we need to social distance, we can't afford to have hundreds of people waiting. And in inclement weather, we can't afford to have people standing in really long lines outdoors. And so what this technology allows people to do is that they can register in advance, select an appointment. Whoever's providing that service knows that they're coming. And so they don't have to stand in a long line. They don't have to risk their health by being too closely spaced to someone. And they just show up, they get vaccinated. That information basically with 2 clicks gets sent to a state database so that we can register them and they'll always have record of their vaccination. And that's what we'd like to make available to the HBCUs. If they want to have clinics where they're vaccinating their students or vaccinating their faculty, they can use this software to be able to register them. It allows you to plan. You know how many people are going to be needed to administer the vaccine. You know how much space you need to administer the vaccine. You know how much vaccine to order because people have alerted us in advance that they're coming. far too often in public health, we just put out a call and say, come one, come all, and we don't know if we're going to have enough vaccine or enough staff or enough space. So this allows us to plan, and it plays a key role in being able to respond. One of the key things about getting this vaccine is that you have to report that you've given it to somebody. And if you don't have a system that's connected to a state immunization registry or the federal government's registry, then you can't participate as a provider because it is required that you have to account for the vaccine that you're administering. And for HBCUs and any other institution that's financially strapped, for them to be able to go and find hundreds of thousands of dollars for a system that they may or may not use for extended periods of time, it's just not a feasible undertaking for them. So we'd like to remove that barrier. We also are going to be providing technical assistance to these institutions so we can help them to understand just how they can use the software and couple that with other lessons that we learned in our decades of having mobile clinics and clinics based in the community. We'd like to be able to support them and help them and guide them in holding these mass vaccination clinics. And it's our vision that not only will they stop at their students and faculty, but they'll reach outside the walls into the community and invite community members to come and be vaccinated. But first, to learn about the vaccine, because there's a lot of distrust, as people have been talking about, in these communities that are underserved and communities of color. And so before we can say, hey, come and take a vaccine, we have to explain to them, address some of their concerns. And there are a lot of concerns and fears that people have. They're valid because of our history in this country and our experiences and with some of the medical establishment. So we need to first educate people and then make the vaccine available to them.
And on that particular point, you talk about education. This is where, and again, I've long said this here, you cannot have these folks who are in charge of messaging, frankly, talking to white folks. You got to have black experts talking to black media platforms, walking people through. One of the reasons why, when COVID hit, we had black experts on this show, black doctors, black ER physicians, black scientists from HBCUs who were talking about this, where black folks said, I can trust that person in what I'm hearing. That also has to happen.
I agree. I agree with you wholeheartedly. And, not only have we not reached out to Black people, but we haven't reached out to people at all. There's been very little communications and promotion and campaigns about what to expect. So we're hearing from the news media. So people like you are bringing on experts and they're saying, well, you might feel a little sick after you get the vaccine. Well, that's important information that needs to be communicated in every media channel. So it should be on the radio, billboards, bus ads, television. We need people to know what to expect, because if people already are a little skeptical and leery of the vaccine, and then their neighbor goes and gets a vaccination, and then they're sick for 3 days, and that just can perpetuate a lot of misconceptions and misperceptions about the vaccine that we really can avoid through an educational campaign. So we have to have a very compassionate and thoughtful strategic approach to engage the Black community in this effort. It really disturbs me, especially because I lost someone close to me this morning, that there are so many people who are hesitant about this vaccine. And I think that we've known this for a while. We know that in general, sometimes the African American community is hesitant about vaccines. And so we have to start now educating them. African Americans are disproportionately affected by this by this disease. We're also disproportionately affected by the quarantine and having to be essential workers, still going to work and being continuously exposed to the virus. And so when you think about this population that's out there, I'm fortunate enough to be able to work from home. I'm not taking public transportation anywhere. But if you think about some of these communities where they have to rely on public transportation, where they're working these essential jobs, where they're exposed on a daily basis, and they're not protected, and they're not planning to be protected. So not only have they been affected, but now they're continuing to put themselves at harm when other people will have taken advantage of the vaccine. And African American communities are still left unprotected because we haven't done an effective job at proactively educating them, letting our people know now what to expect, why it's important, that we have already been socially and medically and economically disadvantaged disproportionately. We cannot continue this. This has to stop.
All right, then. Well, look, we certainly appreciate the work that you do. If there are HBCUs and others out there who want to actually reach out to you for the technology you're talking about, how do they do so?
They can go to our website. It's multi-state P and then the number 4P. The number 4 and then P.com. So multi-state P4P.com. They can go to our website. They can complete a contact form, and we'd be happy to reach back out to them. And also, they can give us a call at 410-902-4677.
All right, Tiffany Tate, we really appreciate it. Thanks a lot.
Thank you.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honoré, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he's the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner OMARI Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach Deborah Owens, Dr. Corey Abear, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. TSHAKA Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha BRAVEBOY, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriot with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon McDougall, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.